Michael, you are absolutely correct. I have been going to Canada since I was born. I know a Canadian doctor who I grew up with, and uh, it the healthcare is in bad shape. The doctors are not happy because they're overworked. They are underpaid. The doctor that I know is also married to a doctor. They spend their summer vacation filling in at rural hospitals that cannot attract doctors. In addition, I know a woman, she and her husband own a restaurant. She has what is probably a minor knee problem, but it causes her a lot of pain and she's limping and she needs the care of a doctor, and she has to wait 18 months before she even sees a doctor. How the United States thinks that they are going to solve our health care by mirroring the Canadian health care is, I don't know what they're thinking. They're not thinking. You mentioned that 15% of your people can't get or can't get seen by a doctor. That's probably more than the percentage that we're trying to cover now in the U.S. I'm not sure about that, but I think that's the case. Um, I know also for a fact you were talking about how high the taxes are to pay for your health care, and I know what that does. When you're in Canada, cash is king. If you can pay cash, they're happy to knock the tax off of your bill, whatever that bill might be. So that cuts into everything also. It's a quasi black market, you know. And we're headed that way. Oh, gee, it's 20 bucks. Well, if I pay you cash, how much? 15 maybe? The taxes in Canada are crazy. The doctors in Canada are not well paid. You are correct. A lot of them do move to the U.S. because they make more money. They spend a lot of years learning to do what they do, long, hard hours. They're not being compensated. I think a doctor in Canada makes maybe $70,000 a year. Hello? And they're paying the same taxes too. Um, just so you know, we also in the U.S. have to wait for care. If you go to the emergency room, and my girlfriend just went, and you know they put her in the hospital bed. They're happy to bill her insurance, but she was there for a day and a half before they ever really did anything. Why? I don't know. But they kept her overnight. They kept her. You know, it's just crazy. I mean, we need help here in the U.S. too, but Canada is out of control. You are correct. We also have issues in rural areas. I'm in a somewhat rural area, and we have a shortage of good doctors. We do have lots of doctors, but the good ones, they, you know, you're either in or you're out. They're not accepting new patients. And if you're not lucky enough to get in, then you're thrown to the wolves a little bit. And in areas that are even more rural, it's probably even worse. So, you know, neither one is perfect, yours or ours. I do agree Canada's is abysmal, in my opinion. Um, I don't agree that the doctors are inept, but I'm a little inexperienced there. I only know the doctors that I know, and I'm sure they're wonderful doctors. They're certainly wonderful people that work very, very, very hard because they have to. But to think that we could mirror Canada's healthcare plan and get what we need, no, I don't think so. So I'm with you. Warning, warning, warning. Do not think that we are going to get good health care by mirroring Canada's health care. Thanks for your post. Talk to you later.